Hello everyone, a very good morning to those who are joining us from Singapore and Asia, and good afternoon or good evening to all of you joining us from other parts of the world. Thank you for being here with us for today's online event on the future of patient care in a digital world. My name is Jin from SGInnovate, and as a Singapore government-backed investor, we have been building up and driving deep tech innovations in AI, healthcare, quantum tech, and autonomous technologies across various industries. We are very happy to be partnering with Catalyst for this event today. Catalyst is a new innovation hub that connects med and health tech startups and clinician innovators to help turn their ideas into products and services that prevent or cure more diseases and save more lives in a scalable manner. Today's topic is one that is close to our hearts as the global pandemic has affected the lives of many over the past year and has been a huge test to many healthcare systems around the world. So how will the future of patient care look like, and what can be or is already being done? These are just some of the questions that we hope to address in today's session. We encourage you to engage with our speakers during the session by submitting your questions in the Q&A box located on the lower panel of your screen. We will also be having a few polls throughout today's session, so do join us in polling by clicking on the polls box located next to the Q&A one. Without further ado, I would like to invite our moderator, Chris, to start us off. Chris, please.
Many thanks, Jen. Hello to everyone out there, and thanks as well to the hosting parties. I understand we've got representation from corporates, from startups, from academia, government, from payers, providers, so just another classical ecosystem discussion, which is great. I also understand we have people dialing in from all over the world, so a benefit here of the virtualized nature of the way we're communicating now. So looking forward to good discussion. Yes, my name is Chris Hardesty. I'm the director of KPMG's Healthcare and Life Sciences practice based here in Singapore. So working on health system transformation and redesign with many of the countries in the region, as well as bringing the medical technology and biotechnology innovation to the market as well. I thought the title today is quite interesting because here it's not specific to digital health, although we'll be speaking about that quite a bit. But my interpretation of the session today is how we as digital citizens will experience patient care. So it's obviously a lot broader than just the healthcare technologies themselves. So we'll talk about our health, our care, our well-being, our mental status, even thinking of using healthcare as a mobility tool in the societies going forward. So we'll cover a lot of ground. My team actually, for anyone who's interested, we released a paper a couple of weeks ago, so pretty new, called Connected Healthcare. You can find it online or message me and I'll send you the link. So there's a lot of detail and reference architecture in there around sort of, the digital citizen and digital health. But one point I just wanted to make here was that sort of the number one area seen as the greatest opportunity, but sort of also challenge, is just making our lives a more seamless interaction. So again, that pertains to the health system, but also just generally how we live our lives every day, and the seamlessness of every tool and organization and people that we interact with, and just trying to make that a more seamless experience. So again, something we can perhaps talk about today. Agenda is very loose, so we'll have some opening remarks from each of our panelists here, and then really I would say this time is for you as the audience. So I've got some prepared discussion prompts, but all of the panelists and I agree we're happy to throw those out the window and to take directly the questions from you as we go. So put them in the box, get the things in there you want asked, and we'll take them on the fly. We're not going to wait to the end to interact with you guys. So please do that. Otherwise, we'll just go through the discussion prompts that we have. So on the panel today, a highly distinguished group. We've got Reina, who's a head and neck surgeon within CCS, and she's also the co-founder of Privy Medical, among many other kind of startup and entrepreneurial innovations. So we'll get to hear more about that. We've got Arun, who's the founder and CEO of Creely for surgical site infections. He'll explain that a little bit more. And then Simon, who's the deputy director at SGInnovate, and also the sort of leading some projects like the Digital Health Passport, among some other exciting initiatives. So he'll explain more about that as well. So again, a good representation of kind of clinical venture startup life here. Before I hand it over to them, I just want to do a quick poll of the audience to see where people stand. So I'm going to launch that. Hopefully you see that on your screen. So here we've given this a bold title of the session today about the future of patient care. Do you think it is really here, or it's a little bit of hype talk? few more seconds. Okay, close that, share the results. So a bit of a mixed bag, but if you put the yeses together, I mean, the predominant share is pretty optimistic here that we are on this journey of patient-centric care inspired by some digital tools. So that's including during the pandemic, but even before. But about a quarter of the people still do think it's a bit of hype. So again, please put your challenges in the Q&A. We'll address those as we go along. Okay, I'm going to start looking at the Q&A chat and we'll take those, but first I want to allow each of my fellow speakers here to make a few remarks. So Reina, maybe I just start with you. Any kind of reflections on the topic today before we start taking some questions, or if you want to explain a bit more about what you're working on?
Okay. Hey, hi guys. I'm Reina. I'm a general and a head and neck surgeon at National Cancer Center and Singapore General Hospital. I'm one of the co-founders for Outlook Labs and Catalyst as well. So I think this is a great topic. I mean, digital health and telemedicine, it's becoming extremely popular. I think the COVID-19 kind of pushed it over to make it kind of bring up the importance, you know, where travel and hospital restrictions limited. We're actually in the hospital right since March. We are trying to reduce the number of interactions between patients, healthcare workers, and encounters. So it's kind of interesting to see the very expedited adoption of digital health and telemedicine in Singapore, especially. Coming from the clinical world where, you know, the doctors, nurses, and the rest of us, I think maybe Arun and the rest of people can kind of tell that we are generally a little bit more risk averse. So it's nice to kind of see the adoption from the clinical side of things. And yeah, I'm looking forward to having more chat later.
Great, many thanks. Arun, I'll turn it over to you to talk about your experience with Creeley, and maybe you can go ahead and kind of address this first question that's come into, which is about wearable devices to monitor situation and some of the challenges. So we can discuss it more as a panel later, but why not go ahead and that's right up your alley there. So
yeah, I want to say thank you, Chris. Appreciate it, and I think all the organizers as well. And good morning, good afternoon, good evening. And I just saw somebody dialing in from Russia. So again, really early morning for you. So great. So Reena, again, great introduction. And not many of us know, many of you know, Reena is also an engineer. So again, she's a unique combination of an engineer and a clinician. So she brings in unique perspectives to this. Yes, I started Crowley about 3 years ago, again, with a very clear focus on patient journey post a major surgery. So I think that was a team. We initially focused on post-surgical replacement for joint replacement, getting the rehabilitation automated, digitize it, make the patient outcomes more visible. And we pivoted to a much more valuable thing from a patient's perspective, in the sense detecting infection early. So if you really look at it, it's about 300 billion surgeries that happen every year worldwide. A fifth of those are large open surgeries. And surgical site infections are a very common occurrence, I think from a fraction of a percentage to up to 40% in some cases. And time is of the essence in detecting and treating infections. So with so much happening in terms of antibiotic resistance and patients getting sent home from an inpatient as soon as possible. I think a lot of the healthcare systems in the world are reducing the length of stay, which means infection is really detected when patients are at home or stepped on facilities. So a lot of this bring to the fore the need for continuous patient monitoring and really tracking patients health and well-being, and also how the wound progresses. So that's a little bit of background about who we are and what we do. So we are a team of about 10 people, very diverse. We have operations in the US, in Europe, and also our main country where we do all the research, development, IP, clinical trials is all in Singapore. So we are proud to be an all Singaporean crew in Singapore as well. So addressing, in fact, Reena mentioned one of the good points. Clinician adoption has been one of the big challenges in digital health becoming more prevalent. I mean, I'm one of those who sort of in the first box to say, look, COVID is sort of accelerating, but still not there yet. We'll talk more about it. But again, if you really look at I wish I had a little bit more time, but I want to show you one slide where it is fairly, I hope you can see my screen, healthcare is a very complex ecosystem. So you get patient is the center of the universe, but you get so many decision makers, so many stakeholders, I would put it this way. So any influence, any change, any innovation that's happening in healthcare, especially in digital health, has to be seen through the lens of all these stakeholders. So we'll come back to that, but just remember, it's not a simple thing. A customer and a provider that is much more nuanced in healthcare. Uh, so with that, I wanted to go back to Chris, and of course, he's got a very interesting set of questions, but patient centricity is the key of what we do, and we are really happy to share our thoughts in today's session. Yeah.
Yeah, thanks, Arun. And maybe just before we go to Simon, we already have a question here for you. So, like I said, let's just interact with the audience right away, right?
Absolutely.
So, I want to get to Simon too, but the question here is on the payer side. So you just showed the ecosystem wheel, right?
Yeah.
So within the surgical side infection space, I think there's a question of kind of who is your primary payer there between hospital, insurer, I guess even out-of-pocket expenditures potentially. So maybe you can explain your experience on that aspect.
Absolutely. So we are still an early stage company. So we have we're taking a product through multiple clinical studies, preclinical studies as well. Our target customer is the healthcare system, mainly in the US. That's where our target market is. These healthcare systems under a capitated payment model, which means they get a fixed amount to treat an episode of care and any readmission. So our solution is targeted to reduce readmissions, or at least provide early warning so that the ill effects of readmission and the revision surgeries can be minimized. So they are our first target customer. So by bundling this service as part of their overall cost of the providing service, we want to improve their patient satisfaction and also their revenue from their reimbursement. So to answer the question straight away, hospitals, healthcare systems are our first target base. Eventually, it will become, we have some reimbursement codes available, but eventually, once we have enough data, we hope to get payers starting to reimburse and this becoming part of a standard of care. Yeah.
Yeah, it's always a bit of a chicken and egg,
Yes, it's a chicken and egg.
The approval to get the data, to appeal to other payers, but then the first payer kind of beachhead to help get you going, right? So
yeah.
Okay, great. And we'll definitely come back to both of you, but let me jump to Simon. Simon, make some introductory remarks. And, I did already kind of take the question earlier on wearable kind of, technologies. Obviously, that's right up your alley too. So if you want to touch on that point with some of your work as well.
Hi, Chris. Hi, everybody. Thanks for having me. So I'm Deputy Director in SGInnovate's venture building team. So I actually wear a few different hats, and I can go through them quickly because I think it will give everyone a little bit of perspective on where I'm coming from. First hat is for SGInnovate and our venture building team itself. So our venture building team partners with and invests in really early stage founders who are using deep tech to solve big problems. And when we partner with these founders under a venture building, our venture building mandate, we actually help almost co-found the project with them and help them along the really early parts of their journey. Under this venture building mandate, I'm actually leading two other projects, which are these other hats that I wear. The second is a project called WIND, which is a hardware and software medical device that's used for patients with chronic respiratory conditions. And I'm leading this project through product development and first-in-man trials as well. And then the second, which is maybe a little bit more relevant to our discussion today, is a project very descriptively named for the time being, Digital Health Passport. So we've created a kind of a blockchain-enabled tech stack that allows organizations to easily issue verifiable digital medical records, users to be able to store these on devices, and third parties to easily verify these documents' authenticity. So this is a really new project that was spurred on, I guess, or accelerated by COVID-19. And to start, that's what we're focusing on. So we've partnered with Ministry of Health here in Singapore to issue discharge records for COVID-19. But obviously, there is a lot of different use cases with COVID-19 and elsewhere, and we're really excited about broadening this out and providing verifiable medical records to a whole lot of people. So that's kind of the perspective I come from. It's quite a commercial perspective, but also a small operating perspective in these two different early stage startups as well. I think my broad take on digital health in the COVID era, if that's relevant to discussion, is that I like what Scott Galloway has to say in terms of his 50,000-foot view that COVID's just accelerating things that were already happening, I think, and that could be the traction of new models, whether that's online shopping or remote working. These things were already happening; they're just speeding up. But also the death of things as well. In the traditional industry, this could be brick and mortar. But I think you can apply some of the same lessons to healthcare. We all know healthcare is a very different industry to the average industry. But I do see that incremental models are accelerating in healthcare. We've seen things like telemedicine and all of this do really well out of COVID. But I don't think that, or maybe this is the seed of transformational models accelerating out of this. It hasn't really happened yet, but healthcare, I think, is such an entrenched industry. Maybe COVID-19 will be the seed of something transformational happening in this space.
Thanks, Simon. Already we're getting lots of questions hot and heavy here, and I encourage the audience to use the upvote feature too for things you really like. That will help us a little bit. One question that came in for you, Simon, maybe just a quick answer, and then we'll get on to the panel discussion. So I think there's some interest in the blockchain initiative you mentioned. There was just a kind of question here on the data aspects and interoperability. So maybe just a few remarks on how you progressed on that front so far.
So I can't actually see the specific question, Chris. So I think, data interoperability is something that is massive in all parts of healthcare. And I think it's one of the reasons why these transformational changes haven't happened. By using blockchain, we can start to get around that, I guess, and develop solutions that can get around this massive data interoperability problem. Happy to touch on it further in the discussion that we have.
Okay. I'm going to run another poll here, and then we'll come back to the audience questions. So based on what you've heard so far, I just want to get a sense of where people stand. So again, we have various representatives from the ecosystem on the audience today from many parts of the world. What do you see as the biggest challenge currently to wide-scale adoption of digital health?
There's no all of the above.
It was a tough call, right?
Yeah, I was going to pick all the above.
Yeah.
Few more seconds. All right. And I think to what you guys have said, a pretty split bag. Interestingly, I would have thought the funding aspect probably would have been a bit higher, but it seems to be the kind of lower aspect. So again, something we can take in mind in our discussion today, a bit more on the guidelines and security aspects still of digital health. Okay. Let me jump to the questions then. I'm just going to kind of work through the upvoted a little bit because there are already so many in here. So I think, and I'm going to kind of combine the first two questions together. So there's a little bit here around the human touch, right? And Raina, maybe you can start here on this from the clinician perspective, and then we'll come on to Arun and Simon. But, amongst all these amazing technologies that are available, how do we still achieve a high level of patient engagement and kind of human element in healthcare through all of this?
Yeah, I think that's probably one of the biggest challenges, right? For us doctors who were trained in medical school, we were taught to, we had a lot of years basically practicing on patient encounters. And, when we examine patients or we diagnose any problems, a lot of it requires physical examination. And obviously with like telemedicine and digital medicine and all that, the element of touch is kind of lost. And I think that's the challenge that a lot of the clinicians and a lot of the healthcare professionals have issues with. And so, I mean, I can only speak about what we're doing in SGH and NCC, but a lot of, for example, the telemedicine in my department in head and neck surgery, we're doing it for chronic patients. So patients who come in for conditions that do not really need, for example, a diagnosis, like we're not doing it as much for like cancer patients or anything, but for example, thyroid patients who just needs a top up of medications. So that's kind of things, so more chronic patients who are well, that we're moving towards telemedicine. But yeah, definitely the difficulty of human touch and not being able to actually physically feel and like even examine patients, to me as a doctor, is probably the toughest thing. Yeah.
And I think, and Arun and Simon, I'd love to hear your thoughts too, but I think often we need to change the language a little bit from, replacement or automation of tasks to more augmentation, right? How do you retain the human-centered aspect of what healthcare really needs to be, but and not just kind of use rhetoric that sounds like you're just replacing things, even though obviously we all recognize the gaps that exist in healthcare services and workforce. So Arun, how about you? I'm sure you've had to deal with this topic.
Absolutely, it's a great input. So I think the first human element is empathy. I don't think machines or any digital health would replace empathy. The human connection a patient gets when they meet with the clinician face to face. So that will never change. I think that's I strongly hold the view. Augmentation and sort of replacement of some of the things that a clinician would do. So there's a real example. One of the clinicians we work with in Singapore, he said, look, I can see a patient's respiratory deterioration. If I see the patient in about 5-6 seconds, I can really see it. I would love to be able to put my hand and really feel that effort of breathing. So that's one of the things that a clinician uses his or her sense of touch and then say, like, so he challenged us to say, like, can you find a way using technology to give me the insight when I cannot really put my hand and feel the patient's effort of breathing when the patient is isolated in a COVID isolation setting? So we took the challenge and we've sort of developed I would say a technology prototype that we're testing. So that's an example of where I say two things fairly clearly. One, clinicians are not going away anyway. The technology is not going to replace it. I think the demise of a clinician is overrated. I don't want anyone to go there. But I think clinicians are raising the bar for some of the technology things like, look, I really cannot go and do this in person now with lots of other constraints. How much can you raise the bar in terms of technology supporting my decision, augmenting my decision, and giving me a 360-degree perspective? I think that's where it's like a pilot in a cockpit. I would see it. You still have to fly the plane. That's no giving up on that. But I think the full 360-degree view of situational awareness, what's going on, I think technology can support a clinician.
So a pretty consistent view from two different angles there. That's good. Simon, or is this something you want to comment on? Or
I think clinicians, the human factor is so important, and clinicians I don't see changing. They will be augmented with tools. And that enable them to make better decisions. What could change, I think, Chris, is provider organizations, right? You don't have, maybe there is, and we're already seeing this, I think, in the US, you see full stack digital health companies come to market that still have human clinicians talking to human patients, but they are provided in a very different way. That organization will provide the digital workflow, employ the clinicians, and that full stack is provided to the patient. So it looks a little bit different from the patient's perspective, and it's a whole different workflow, but there is still the clinician at the center of that. So I think that's where you could start from a patient's perspective to see a lot of difference, but in reality, the clinician and other supporters are still there.
Well, and I love the birth of this clinician innovator, concept, like much of what Reina does, for example. And I think Singapore has a good focus on that too. So I think that's a nice way to kind of bridge what you guys are talking about. I'm gonna take this next question here, and I'm just gonna kind of rephrase it so we can be punchy with it. And there's so many questions, I want to make sure we try to get as many as we can. So we're talking a lot about kind of digital health in the sense of monitoring, kind of remote consultation monitoring technologies. But if each of you had to pick one other area of patient care that could be, there could be some digital application. So just pick one. Where do you think is the kind of near-term opportunity? Reina, how about you?
So if I had to pick one to make it digital, wow. I mean, I'm probably biased because like I'm a cancer surgeon, right? So actually cancer care probably is something that I feel like it will kind of be big. I mean, a lot of the innovation in cancer care now is all into like precision medicine, immunotherapy, targeted therapy and stuff. But what I'm really looking forward to is digitalizing the patient journey, a cancer patient's journey, to incorporate all the different, because the cancer patient usually needs multimodalities. They see a lot of different specialties, from surgeons to medical oncologists to radiation oncologists, and so on and so forth. And I feel like it's very confusing for the patient and the caregiver when you do this. So, I mean, this is probably a biased answer, but as a cancer specialist, this is something that's probably will be great if you could kind of digitalize and make it patient-centric, right? So instead of us being anatomy, I mean, I am a head and neck surgeon and there's a breast surgeon, like we kind of should move towards making it patient-centric, such as a breast cancer patient, breast cancer clinic, where one patient goes to one place and see all the specialists in that one place, instead of them having to run around to see different people. So that's kind of something that I feel will be interesting to look at. Yeah.
I love it. Yeah, I lost my own father to mental illness, but he was comorbid with cancer. And so I think just, concepts of digital therapeutics and how do you help someone manage throughout, not just even in the physical aspect of the condition they're facing, right? So I love it. I think that's great. Arun, how about you? You had to pick one area. Oh, you're on mute.
I was on mute, so sorry about that. So I think I would pick post-surgery rehab with focus on patient feedback. And I think if you really look at patients expect positive outcomes, and the current system of care doesn't provide a lot of feedback to the patients when they are going through an extended rehab period. How am I doing? How am I doing with respect to my own goals? How am I doing with my peers, with people in a similar situation? How am I doing with respect to the clinical markers? Am I doing health-wise? So, there's bits and pieces available, but I think if I'm a patient, anyway, I'm going through a lot of anxiety and I'm hopeful. That's where I think I would like to see more innovation coming and more digital innovations coming to synthesize all of this, like say clinical, community, social, to say, who am I, where's my support group? Can I deal with my support group in a secure way, in a sharing way, so there's a whole continuum of care, which we have sort of segmented into multiple pieces, like home health or step-down care, or just on your own at home. But all of this, there is a clear unmet need of, look, I want to get better. How am I doing? Provide me feedback, engage me. That's the power of digital innovation can transform. So I'll pick that. Yeah.
Yeah, it's kind of back to that point I was making earlier about a seamless digital citizen, right? Where, and if you, I'm a fundamental believer in the social determinants of health. So if you look at where we live, our education, all these kinds of factors, right? I mean, we need a bit probably more seamlessness in these digital tools, All right, Simon, you've had lots of time to think, so expecting a top answer from you.
Oh, look, don't get your hopes up, Chris. So look, I mean, a little bit similar to Reina. I think for me, it's chronic disease, but the issue, the fundamental underlying issue is the same, is that, there are so many different healthcare professionals treating people with cancer or with chronic disease or many other things as well, rehabilitation, I'm sure. it's very hard to connect these dots. And I think that's where digital health can really make an impact if it can be implemented in the right way, where we can use patient-owned data and tools to allow interoperability, to allow the patient to own their care pathway, and understand where the different pieces of information fit into their own care and how they can manage their own conditions better. And by doing this properly, we can positively impact engagement that patients have, especially in chronic conditions where the patient can make so much of a difference often in their own life. So I would love to see that this kind of digital workflow using things like interoperability and patient-centric data and own data, I would love to see that implemented. And I think that there is a real upside to a government organization or a provider or some sort of group at least implementing something like this. But it's a huge risk. They run on such thin margins. Hopefully something like COVID, as I said, can be the seed that kicks off something like this.
Hey, if I can Google something and then see a Facebook ad for it 10 minutes later, then this interconnection should be possible, right? All the people that were worried about interoperability and data privacy are worried now.
Totally. I mean, it's just, these systems weren't designed to be interoperable. And from a startup's perspective, it's so hard to bolt something onto some of these systems because of, shoddy endpoints and there's the amount of effort required to onboard one customer is absolutely massive from a startup's perspective. But technically, it also creates a lot of risk for your customers. And with such thin margins, it's a very risk-averse kind of catch-22, I guess.
And I've seen a noticeable uptick in people's just kind of philosophical shift around sharing of information in the recent months. There's still a lot of things to sort out, but I hope that it's the kind of thing we'll just keep experimenting and kind of get it going. Probably some missteps along the way, but we have to keep working, right?
I agree, and I think if you can apply it to one little slither of healthcare and it works, then you can use that as a seed to kind of find broader and broader use cases for it.
Excellent. So let's keep going to the audience here. Thanks everyone for continuing to submit your questions. So again, I'm going to kind of combine and repackage things a little bit here to address a few things at once. So all of you have a direct role in, among your many hats, fostering innovation in healthcare, be it through digital means or other purposes, right? So I see this question come up quite often with entrepreneurs of trying to think of their beachhead markets and, US, Europe, kind of mature versus the great need that exists in the lower to middle income countries, right? It's really a business model question. So what advice would you give to kind of, entrepreneurs seeking to innovate in this space? And to the degree you've looked at, there's a question here about internet penetration rates as a kind of proxy, you could say, to digital health, right? So to the degree maybe in your own strategic plans, you've looked at internet penetration rates as a business model strategy as well, feel free to comment on that. So Raina, how about you? You're on mute. Yeah, there you go.
Yeah, so I think it's tough because we stay in Southeast Asia, and it's a huge market, to be honest, like Indonesia, Philippines, Vietnam and stuff. And I'm personally Indonesian, right? And every time I have to FaceTime or Zoom into my family in Indonesia, sometimes the internet and all get cut off. So I'm not sure, how to kind of solve that issue kind of thing. When it comes, what was your other question? Sorry, maybe you can move on to someone else. I kind of have to give a think about this business model question.
Yeah, no
yeah,
worries.
If you don't mind, sorry.
That's okay. Arun, how about you? Have you looked at this for Creeley already? I'm sure you have. You're on mute again.
So we are disciplined to just keep ourselves on mute. So I keep hitting that. So I think the broad theme is technology penetration, some of the enablers. If I got that question right, how are we baking this?
I think it's sort of looking at mature market, business models. So US, Europe, Singapore versus business model for, countries that have sizable populations and huge need, but the business model would be entirely different, right?
Absolutely. So I think as we know in healthcare, one size doesn't fit all. I mean, this is a classic thing. So there are also, and I think we will come to this, who pays for it. And I think I see through this lens of every service has some value. Who pays for it is when it really comes to a transaction to say, look, I've got a great product, it helps the patient, but somehow the economics of for the innovator to really get to the market is really important. This comes from to say if a healthcare system is spending per capita $10,000 per person, and there's ways of saving a couple of $100 through effective intervention. So I think it's a relatively relatively easier sell than if a system is spending $200 and you want to save $20. It's a bigger challenge for the innovator to do that. But the need is same across these markets. So that's, I think the question's nuance is also, can technology be a leveler? While healthcare systems, there's huge variation in the per capita spend between developed markets and upcoming markets as well. The internet penetration is not at that huge difference. I think there's a little bit more democratized in the sense you can provide a very inexpensive, low-cost digital health intervention that could save lives. There are a few examples that we can also touch later. I think screening for diabetic retinopathy is some of the examples where you don't need a very high fidelity camera. You can use existing infrastructure to really screen people. Huge population health impact can be done. So technology is a leveler. Business models has to be tuned with what is the unmet need, what is the problem that the innovator is trying to solve. Internet penetration could help. Mobile device is becoming more and more ubiquitous. It's easy. And also as a service model, I think more and more I see this trend as you don't have to own a device. Say, look, I have a specific need. I'm going to rent the service or pay for the service as long as you need it. That keeps the capital costs low and makes it much more affordable. For example, again, there's a little bit of a plug for it. We said, like, what if we could make a small one-time fee plus $12 a day kind of a monitoring fee for as long as the clinician says the patient needs to be monitored for infection. That sets it still gives us a reasonable return on our efforts and investments. But from a value perspective, you're not going to say stuck to buying $1,000 device and one-time use. So that is changing. So my summary on this is business models. There are lots of business models out there. Technology, I see it is not extending the divide, but bridging the divide. And I would say technology is a leveler, and I see this, I'm on the optimistic side of using technology to bridge the gap. And number three, more and more service-oriented, zero capital asset service models are the vogue. I think they would see more and more progressing in the next few years. So I'll stop here. Yeah.
Thanks. I know I need to double check my facts, but I think for example, internet penetration rates are fairly optimistic, and I know there's a lot more ubiquitous plans of rolling this thing out. So, I think for those kind of innovators that are looking at the IoT style digital health, and there's some ways underneath in your product design to, for example, to do offline, features and kind of keep the care continuum going. But then when you are on the network, it's kind of backs everything up, right? So it's also not a black and white answer either, So, Simon, how about you? Just coming back to the core question here, which is kind of emerging market strategy versus, developed markets.
Look, I think, having seen a few pictures in my time from innovators, I would give a piece of advice to people who are having investor discussions, is that they just need to be very clear on which one that they're chasing. And they need to be able to articulate very clearly about why and what are the dynamics of that market that suit the solution or that create the need for this solution. A solution that is designed for Indonesia is likely not to work in India, let alone in Europe or America. And that's absolutely okay. There's nothing wrong with that. But that fundamental design has a lot of knock-ons to the business and to the investment as well. So, I'm not going to give anyone a silver bullet in this sort of emerging market versus your classic medtech markets, but it just does need to be thought about very, very closely and articulated well in the conversations that they're having.
Yeah, and I think, and Simon, you and I have talked about this. I mean, I call it kind of dilemma thinking, which is instead of making decisions, binarily, you can look at kind of what are the hybrid options. And for example, I do see increasingly that the startups that are kind of having a dual track approach for go-to-market, so you can have a kind of regulated, FDA track, but then simultaneously have a different kind of version of your product that is a bit more B2C and perhaps, focusing on the out-of-pay markets for some of the emerging large population groups. And that's where all kinds of innovative partnerships could be born, like with credit card companies or whatever, right? I mean, there's a number of new business models popping up like Arun was talking about. Go ahead, Simon.
And that's the beauty of digital stuff, of software, is that you can charge $100 for it in one market and $1 for it in another market. There's no cogs weighing you down. It's much harder to do that for something that's hardware based.
I have a question to ask Arun and Simon if they, because I see a lot of the questions coming up in the Q&A about insurance cover for telemedicine and stuff. I only know what's happening. I pretty much am more comfortable what's happening in SGInnovate and SGH is that the telemedicine charge, it's still considered in-hospital kind of charge. So you can still pay for it that way. But do you guys know what's the insurance kind of coverage in general? No.
So I can try. So I think it depends on which market. If it's just a telehealth, meaning like a patient sitting in front of a clinician and doing a remote consult, there are reimbursement codes available, at least as far as I know in the US. It's been a couple of years now. Whether it's mainstream practice, and for example, to say, look, I have a policy from one of the insurance majors and I could choose to go in person or virtual, and the provider gets the same reimbursement whether he or she sees me in person or remote. I'm not sure on all the details, but I think the trend is getting more and more acceptance that virtual is no less than in person. So I think there's always this thing, if you see virtual, that's less valuable than you see the patient in flesh. But I believe that gap is narrowing, but still something to be bridged. I'm sorry, I can't give you a specific answer, but I see the trend. I think the trend is bridging the gap. I don't know, Chris and Simon, you may see from your vantage point things much more than I do from my narrow field.
Well, if I could ask you one follow-up question, because Reina took us exactly where I wanted to go, was into this whole payer discussion. There's a lot of questions on that. So maybe you already having the payer discussions, Arun, public or private? You've already kind of gone down
so
this path?
we have talked to the hospital big systems, yes, a couple of them, yeah.
So there's and maybe just a quick answer on this one, but to the degree of liability, right? And then we'd love to hear from the others too. But I think with digital health, in terms of the data, in terms of the liabilities around what's working and what's not working, have you ventured into those discussions yet? Any learning so far?
I think the clinician was concerned about liability. For example, what if I miss an alert coming from your system? Would I be liable for it? So that's a question that it is still out there. I would say it has not been conclusively said. So in that, we said, like, what if we could put a kind of a human triage who say, look at all, call it a 24/7 call center. I mean, for one of a better thing, if there are 200 patients and each patient is sort of the device is sending some alerts, somebody is triaging it and making that alert meaningful to a clinician. That is still an issue. It's not been conclusively addressed from a clinician perspective. the payers, the healthcare systems are looking more, how am I going to pay for it? What risk adjustments? So again, risk-based repayments. I think we'll maybe talk some other time, but that's where I see more and more the conversation to say, like, look, we do something together. I'll pay you a small fee to get it started, but the reward comes once we look at the metrics and there's a cost sharing or the revenue sharing option. That's where I think the conversation was.
There are a few elements of risk there then in terms of how the technology is working and the roles, but then also the nature of the financial agreements as well. So before I go to Simon, Raina, did you want to say something to Arun, or should I?
Oh, no. I mean, just to answer the liability part as a clinician, I mean, I think that's kind of like one of the scariest part of doing a teleconsult, right? Because as I said, in medical school, we're taught to always examine, always touch. You know, a lot of the things are used with our hands and our sight kind of thing. So, for example, if a young patient comes in with just abdominal pain, I mean, do you just send the patient back with like gastric medicine? Or, I mean, most of the time we'll have to examine the patient to rule out, make sure that we don't miss out cancer. So I'm not sure with the other startups that are going on with telemedicine, but eventually as a clinician myself, I would feel like it's my responsibility and I would feel bad if I miss out something dangerous in that person. So I'm not sure if it answers it, but I think that's one of the hurdles that clinicians and doctors take, as what Arun has mentioned, is missing out something life-threatening and bad.
Thanks, Raina. Simon, any comments on this one?
Not really. I mean, not having a business and market in the US myself, I'm not an expert in it. When we look at companies, we deep dive these things, but we deep dive them very specifically. I would say that this sort of thing is accelerating, and I think COVID's helping with that. And I think insurance companies and others are seeing the benefits of these sort of things. Long-term traction remains to be seen, and I'm a strong believer that telemedicine is an incremental thing. It's not the end result of where we're going to end up, but it is a step that we're working through. I think you can solve some of these issues if you go full stack and bring the clinician in-house and provide insurance like Airbnb does for people renting on their platform. You can provide insurance for clinicians operating on their platform and things like this. So there are some workarounds, but there's no silver bullet for it.
And for anyone interested, maybe less on the liability side, but more on the reimbursement side, I would recommend to check out APAC Med, which is the Asia Pacific Association of Medical Technology. They have a digital health committee now, and there's a number of kind of papers on reimbursement policy and stuff too. So that's a great resource for those of you looking to go on that journey. All right, we're a few minutes left, so I'm going to rapid fire some questions that are earmarked for specific people. So Raina, there's one in here for you, which is maybe a bit of people trying to get the clinician insight here in their own entrepreneurial journey. But in your own line of work, have you already seen the influence of AI and IoT? I mean, can you give some examples maybe of where you're already starting to see this in your own work?
Yeah, of course. I think one of the examples, if you ask, is, for example, I have a good friend who runs a startup called BotMD, and she's doing a chatbot using AI to kind of help not the patients, that she's targeting more of the hospitals and the staff, putting in call rosters and protocols and coding it into to a chatbot such that it helps the young doctors and the nurses and all on the ground. So yeah, I mean, there are definitely use of AI and stuff that's starting. And to protect the privacy and everything in Singapore definitely has to go through IHIS. So IHIS, you need to make sure that your platform or things is compatible with whatever IHIS allows, and so that's kind of like a gatekeeping in Singapore's technology. Yeah.
Cool. I'm sure if people want, they can reach out to you and discuss further.
Yeah, of course.
Okay, Arun, one in here for you. So there's a question about the FDA's new Digital Health Center of Excellence. Have you seen that? Does that affect your world? I don't know if you have a view on that or not, but it was.
No, that's a great question. So we have been looking at the Clinical Decision Support System, CDSS guidelines, and ours is a combination of a hardware medical device and a platform solution. So though I've been tracking FDA. So this specific center, not yet. So thank you for giving me this heads up. So I will take a look at that. Yeah.
Simon, I don't know if you're looking at, are you looking at that center, or not to put you on the spot, but.
I've had a look at it. We'll see what comes out of it.
So, okay, another question here for you, Simon. So obviously SGInnovate, you're looking across many industries and many types of technologies. How do you, maybe you can give us a bit of an inside view into how you guys create the business case for digital health and certain types of technologies that you look for? How do you even go about that process?
So the investment case or the business case?
Business case. But I mean, feel free to answer it within the realm of how you look at stuff, right? So.
It's, I mean, for me, we look at the investment case, which is, you know, we look at the business case as part of that. And it's, you know, it's a very holistic view. There is, you know, I think a lot of the people that we talk to are very specific. Maybe they're clinicians themselves, or the technical innovators, or perhaps they come from a more, you know, MNC commercial type background themselves. And what we find is often a conversation that we have with these entrepreneurs is broadening out our initial discussions with them to a more holistic piece, where we look at such things as, you know, value prop to payers, value prop to providers, what you know, what hurdles they may overcome, what the specific clinicians may, you know, whether there will be any pushback from clinicians, or the ease of integration of this into their existing workflows. And then we look at the team, we look at the specific problem and where that problem is. We look at what markets might be experiencing that problem in the future that aren't now, and the growth of these sort of things. And it's very, you know, there's no one answer to this. It's a very holistic assessment where we look at the entire end-to-end piece and see whether it makes sense. And as you can imagine, to my comment before, if you're going to look at a emerging market rather than a kind of classic medtech market, then that's going to impact a lot of those things that I just mentioned in terms of what we would look at and the conversations that we might be having with companies.
Thanks, and not to put words in your mouth too, but I've noticed kind of and again, you and I've talked about this, but a bit of a shift from, you know, IP is still important, but looking really at the go-to-market kind of, you know, proposition that's being put forth early on, right? It's no longer that you can spend 10 years developing something and then start thinking about commercial strategy. I think it has to happen a bit earlier. And I think also even during the COVID, but before, I do see a kind of greater influence of concepts like ESG and really how you make an impact out there in the world too. So it's this kind of balance between, you know, an earlier go-to-market position, but also doing something for the greater good, right? Totally.
And I think that's very important. On the IP front, you know, people have very different perspectives to IP. IP is important because it is essentially protecting a operating business's margin and growth over time. If you're the only person that can sell something, you have better margin, you have better growth. And if you don't, if anyone can sell it, you get squeezed on both of those things. So IP is really important, but I've never seen IP win a deal by itself, right? Like no one's waving around a patent and money gets thrown at them. It's just one piece. It does often kill a deal though. You know, if there's no defensibility, then investors can't expect probably whatever return that they're hoping to return to take the risk on such an early stage business. And are any of you guys working in home-based blood tests? There was a kind of upvoted question here. I don't want to put people on the spot, but if anyone has a quick point of view on that, I'm
no,
sure.
Unfortunately, we are not working on that space.
Chris, do you have a point of view on that?
Whoa, put me on the spot, huh? I guess what I would say just quickly, because I want to ask a couple more questions before we wrap up, but I think, you know, aligning the digital, if I could call it that, kind of innovations to the way the models of care are being designed, I think that is going to be key for people who want to innovate in this space. So on one hand, you know, the home-based model is very good because that is kind of the direction of travel of health systems, right? Which is community-based, home-based care. I also am excited by technologies that are, you know, non-invasive, such as like breath tests and things. I mean, we're going to see a huge upsurge in this. I have seen challenges in the business model of home-based kits though, because there's a lot of confusion around who's responsible for the testing and the handling, who's actually paying for it. Is it the consumer? Is it insurer? So I think it's an exciting space, but still a lot of kind of kinks to be worked out there from what I've seen. Thanks for putting me on the spot, Simon. Okay, well, we're getting close to time here. I think I had one final question that kind of puts a lot of this together. I think we were able to get through most of the questions, so thanks guys for being patient and kind of rapid fire. But if you had to pick one thing that you hope will never go back, so this part of this discussion today is the future of patient-centered care, right, post-COVID era, and it doesn't necessarily have to be specific to digital health. It can just be kind of how we live our lives, even, for example. But if each of you had to kind of pick one thing you hope doesn't go back and you feel very optimistic for how this can take us forward, would love to hear your perspectives there. So Raina, I'll start with you.
I think for me, it has nothing to do with digital health, but I feel like actually wearing masks so far has reduced the number of like patients who, people who get sick in general, right? Influenza numbers are down. My kids are not getting sick as often, so I don't get sick as often. So actually, I don't know, this mask thing, although yes, I'm comfortable, and social distancing and stuff, it's actually pretty good for general health, I feel. Yeah, but that's just random. It's not digital health related at all.
Yeah, but that's good, because then for all the people listening today, there's your innovation opportunity, right? How do you kind of take this user demand and I loved in all the MRT stations now, there's whole mask shops, you know, my kids as well love to pick out their design and stuff. So
yeah,
I see where you're going with that.
And maybe one more thing is that it actually speeds up a lot of the innovation process. I mean, we just created a robot for swabbing, and to be honest, it's kind of like my fastest project. Like from idea to market, it was 4 months. It would never have happened without COVID. You know, people just like doing things much faster because it's a COVID related project. But that's the other thing. So yeah, Arun, it's your turn.
I saw that. Congratulations on that.
Yes,
that was really great.
It was a great idea. Yeah,
it was a fun project, but yeah, I'm just impressed at how fast it is, because it would not have been done if it was not COVID. Yeah.
Amazing.
Arena, I really recall the day that when we spoke about a few months ago, you said, look, you just came back from a marathon swabbing exercise, and
I know.
you were just exhausted that day.
It was terrible. Yeah. Yeah.
Lots of good ideas there.
Yeah, I think
Arun,
it's great. Yeah, so I think in the interest of time, I said, like, I think the pandemic has created a lot of pain, but also the opportunity of listening to other ideas. And I think we're all doing this. So I want to give one plug for this. Some of the answers for solutions lie outside of technology. So one of our advisors said, look, she said, did you know that anemia in women, young women, is a very common thing. And if you just squeeze your thumb, like fingers like this, there's some indigenous technology. Indigenous people have really found a way to understand the degree of anemia by just a simple heuristics of pushing the fingers in a particular way. So I was just saying, like, what if some of these things could be, we could learn from these people, the body of knowledge out there, maybe digitize it, maybe standardize it. And I don't want this pandemic to lose out on all this knowledge coming from the people. Excuse me.
Yeah, well said. No, sometimes I kind of laugh when we talk about home care being this evolutionary concept, because I mean, in some ways that's how all of this started, right? So sometimes we have to come back to our roots, I think. All right, Simon, again, you've had a lot of time to think, so you got to bring us home here with really some powerful wisdom.
So, I mean, we'll see. So I think on the healthcare front, you know, the urgency and the collaboration we've seen has been fantastic. And like Raina, I hope that we can continue that, hopefully once we get on top of this current crisis, because it is what healthcare truly needs. You can't be, you know, pilots and things like that are the death of so many digital health companies, because it's just so hard. And COVID has really provided that massive need for urgency to deploy solutions that are maybe, you know, a little bit not as polished as providers maybe used to be seen, but there's that need for it, and it's been fantastic. And I think with that sort of attitude, we can really start towards those transformational changes that the healthcare industry so desperately needs. So that's my healthcare piece. And I mean, from just you know, a complete business piece, I hope, Chris, that we've done away with 3-day conferences. I don't need to go and spend 3 days in a massive room with 20,000 people. I don't mind a day, maybe a day and a half for some like workshops that are super relevant to me, but hopefully gone are the days of 3-day conferences.
Unless it's an SGInnovate conference, right? Then fully.
We don't hold 3-day conferences, Chris. Just 1 day, once a year. That's it. Deep Tech Summit.
Well, there you go to everyone listening out there. Lots of ideas to hack healthcare or wider, which is how we started this discussion, which is this is not just about digital health, it's about the digital world and being digital citizens. So I hope you enjoyed the discussion. We tried to answer as many of the questions as we could. Appreciate that interaction. Thanks for the hosting parties and thanks to the panelists as well. The survey at the very beginning, people were quite optimistic about patient care arriving. So I hope all of us can continue to work together. And with that, I hand it back over to the hosts to close us out. Thank you.
Yeah, thank you, Chris, and thank you to our panelists for the great sharing, and thank you to everyone for your ongoing questions. It's always very heartening to see so much enthusiasm at our online sessions, but real conversations often happen after, so we do hope that all of you can keep connected. The recording of this session will also be uploaded on SGInnovate's YouTube channel, so do head on there for a review of today's event, and till our next online event then. Thank you everyone, and bye.
Thanks.